ሰላም ዘሪሁን ነኝ በባለፈው ጊዜ አናቶሚ ኦፍ ኤሶፋገስ አይተናል ዛሬ አናቶሚ ኦፍ ስቶማክ እናያለን አብራችሁን ቆዩ Anatomy of stomach is mainly found between the terminal parts of esophagus and the beginning of duodenum. So in this section we will discuss about the topography of anatomy, mainly the topographical structure of anatomy, external feature of anatomy, parts of stomach, layer of the gastric wall, and finally we will discuss about arterial supply, venous drainage, and nerve supply of the stomach. እነዚህ ነገሮች በዚህ section እናያለን አብራችሁን ቆዩ So the stomach, when we can divide the abdominal wall into 4 quadrants. በአራት ኳድራንት ከፍለን ማየት እንችላለን. The right and the በአራት ከፍለን ማየት እንችላለን. So the location of the stomach is determined on this quadrant. በእነዚህ ኳድራንት የስቶማክን ሎኬሽን assign ማድረግ እንችላለን. So the stomach is mainly found the epigastric region and the left hypochondriac region. Left hypochondriac regions as well as epigastric region is the location of stomach. Look, this area is the epigastric region of stomach. So this is the stomach. So stomach is found at the epigastric region. And the other location of the stomach is left hypochondriac region. This is the left hypochondriac area. So some parts of mainly the body and the fundus of the stomach is found at the left hypochondriac regions. So this is the location of the stomach when we divided abdominal wall into 4 quadrants. በአራት quadrants እንከፍላቸዋለን. When we divided the abdominal wall into 4 quadrants, በአራት quadrants እንከፍላቸው, that is 9 quadrants by 4 lines, and we can divide the abdominal wall into 2 by 2 lines, the vertical and transverse line, mainly subcostal transverse line. We can get 4 quadrants. አራት ኳድራንቶችን ማግኘት እንችላለን. So the left upper quadrant and the right upper quadrant, we can get the stomach into 2 quadrants. Most of the stomach part is located on the left upper quadrant, but some parts of the stomach is located on the right upper quadrant. So the topographic gastrics located the terminal points of esophagus. Esophagus terminal point ላይ ነው እናገኘው, and it ends at the junction of duodenum, mainly small intestine. So the stomach is found between esophagus and small intestine, mainly the first parts of small intestine, which is called duodenum. ስለዚህ በኤሶፋገስ እና በዱኦደነም መካከል የሚገኝ ስትራክቸር ነው ማለት ነው. So at the junction of esophagus and stomach, at the junction of, we can get one orifice which is called cardiac orifice. So this cardiac orifice is the orifice which is located between the esophagus and the stomach. And when we compare the location of this orifice, it is found at the level of T11. At the T11 level line እናገኛት orifice ነች. This orifice is separate the esophagus from stomach. The other orifices the second orifice is found between the smallest intestine, which is the first parts of smallest intestine, which is called duodenum, and the stomach, which is called pyloric orifice. The pyloric orifice is located at the level of L1. Generally, the stomach is found between T11 and L1. በT11 እና በL1 መካከል የሚገኝ ስትራክቸር ነው ብለን መናገር እንችላለን. So The pyloric orifice mainly separate stomach from the duodenum. Mainly the pyloric antrum of the stomach from the first parts of the duodenum. When we see the stomach on the back side, the ጀርባ ሁነን ብናይ, we can get such likes of figure. እንደዚህ አይነት figure ልናገኝ እንችላለን. So the stomach has anterior wall and posterior wall. Anterior wall እና posterior wall አለው. When we see in the back side, በጀርባ ሁነን stomachን በምናይበት ሰዓት, so there is a relationship of, or the syncope of the stomach. Syncope means the position of the organ to the organ. Syncope means the relationship of one organ, one abdominal organ with another abdominal organ. And abdominal organ ከሌላኛው abdominal organ ጋር የሚኖረው relationship ማለት ነው. So the anterior wall of the stomach related to the diaphragm superiorly it related with the diaphragm and the liver, the anterior abdominal wall. So the anterior wall of the stomach has a relationship with diaphragm, liver and anterior abdominal wall. ስለዚህ stomach anteriorly ከነዚህ structures ጋር related ያደርጋል ማለት ነው. The posterior wall of the stomach is related with closely related to the left kidney and closely related to other structure which is called spleen and pancreas. So the posterior wall of the stomach has structurally related with closely related to the left kidney, spleen and pancreas. ከነዚህ structures ጋር posteriorly related ያደርጋል ማለት ነው. And transverse colon. Generally, the anterior wall of the stomach is related with the diaphragm, liver, anterior abdominal wall. Posterior wall of the stomach has a relationship with the left kidney, spleen, pancreas and transverse colon. ከነዚህ structures ጋር posteriorly as well as anteriorly related ያደርጋል ማለት ነው. So the relation of syntopes of anatomy, the syntopes of stomach is those. When we see the external feature of the stomach, ከውጭ ሆነን stomachን በምናይበት ጊዜ, we can get different parts of the stomach. stomach የተለያዩ ፓርቶች ማየት እንችላለን. On the left side, we can get the lesser curvature, which is small curvature, and on the right side of stomach we can get the greater curvature. So the greater curvature and the lesser curvature, as well as at the end of the lesser curvature we can get small depression. Almost all small depression ባንለውም ጎድጎድ ያለች ቦታ እናገኛለን. That notch is called angular notch. So the angular notch indicate that the end of the lesser curvature. In the beginning of the greater curvature, greater curvature beginning ላይ ደግሞ የምናገኘው notch አለ. That is called cardiac notch. So the angular notch is found on the lesser curvature. The cardiac notch is found at the greater curvature. So greater curvature form የሚያደርግልን cardiac notch የምንለው አለ. So this cardiac notch is formed by the terminal parts of esophagus and the fundus of stomach. The fundus of stomach እና በesophagus form የሚደረግ ነው. እንዲሁም ደግሞ it is mainly formed by a greater curvature, but the angular notch is formed mainly by the lesser curvature. The end points of angular notch is lesser curvature. ስለዚህ lesser curvature መጨረሻ ሲጨርስ ራሱ angular notch አድርጎ ይጨርሳል ማለት ነው. So those are the curvature as well as notch. curvature እና ኖቾችን በምናይበት ጊዜ, when we say about the parts of the stomach, የስቶማክን ፓርቶች በምናይበት ስናይ, so the parts of the stomach has different parts of stomach. We can get the cardiac part. The cardiac part is located between the fundus of the stomach and the esophagus. The other parts of stomach is fundus, which is the most superior parts of the stomach is fundus, and other parts of the stomach is the body of the stomach or the body of gastric. The body of gastric is large parts of stomach. The smallest parts of stomach is cardiac part. So the cardiac part is smaller part. Fundus is the most superior, and the most larger parts of the stomach is body of gastric. በጣም ትልቁ part body of gastric ነው. And the fourth parts of stomach is pyloric part. So the pyloric part further divided into pyloric part እንደገና divided ማድረግ እንችላለን. We can divide it into two. First one is pyloric antrum. The pyloric antrum is found between the pyloric canal and the body of the stomach. And the second part of a pyloric part is the pyloric canal. This pyloric canal is located between the pyloric antrum and the first parts of the duodenum. የዱኦደነም የመጀመሪያው part እና the pyloric antrum of the pyloric part of the stomach መካከል የሚገኝ structure ነው. The pyloric canal is the narrowest parts of the stomach. በጣም ጠባቧ canal pyloric canal ነች. This canal is mainly surrounded by the pyloric sphincter of the stomach. So the pyloric canal is mainly, that is, the end points of pyloric canal is the sphincter, which is called the pyloric sphincter, which is mainly formed by the muscle of the stomach. The stomach muscles form የሚደረግ sphincter አለው. So the end points of pyloric canal is pyloric sphincter. When we see the histological parts of gastric wall, ይህ anatomical structureዎቹ ናቸው. gastric wall በማይክሮስኮፕ ከስቶማክ ላይ የሆነ ሳምፕል ነገር ወስደን በማይክሮስኮፕ በምናይበት ጊዜ histological layerዎች አሉ. the layer of gastric wall mainly histologically ነው separate የምናደርገው. grossly በጣም ከባድ ነው, difficult ነው, but we can do the muscle and the mucosa layer, but each layer is separated in the form of histology. By histology ነው mainly ማወቅ የምንችለው. So let us take some sample. የሆነ sample ነገር እንውሰድ ቆርጠን. ለምሳሌ body of stomach የምንወስደው sample እና ፈንደሱ ላይ የምንወስደው sample ይለያያል. pyloric antrum ወይም pyloric part ላይ የምንወስደው sampleም ይለያያል. ስለዚህ አሁን የምንወስደው sample ከየት ላይ ነው ማለት ነው? At the body of stomach. So at the body of stomach we can see types of layer. The first layer of the stomach is mucosa layer. የመጀመሪያው layer mucosa layer እንለዋለን. The mucosa layer is a layer which is called tunica mucosa, and the size of tunica mucosa is around 2 up to 3 cm. ስለዚህ በጣም large ነው. stomach ላይ የሙኮሳ ላየሩ በጣም ረጅም ነው ማለት thick ነው, because in order to prevent the gastric acid and some chemical which is affect the stomach. So in order to resist those toxic substance, the mucosa layer is thick. It takes around 2 up to 3 cm. ከ3 cm የሚሆነውን thickness ይወስዳል. So the tunica mucosa is mainly formed from different types of muscle layers. So the tunica mucosa forms a gastric fold. በጣም fold form ያደርጋል. ውስጥ ላይ ስቶማክን ሰንጥቃችሁ ወይም ዳይሴክት አድርጋችሁ ብትገቡ fold form ሆኖ ታገኛላችሁ. So those folds are formed by tunica mucosa. The tunica mucosa form የተደረጉ layers ናቸው. Look this is a gastric fold mainly formed by the gastric mucosa, and this fold increase the surface area of the stomach. The stomach surface area ይጨምሩልናል. So the most elevated part is called area gastrica, and the most depression part is called area sulca እንለዋለን. So the tunica mucosa is mainly formed the cell of simple columnar epithelium. A simple columnar epithelium is a types of epithelial cell which form the stomach, the lower parts of the duodenum, and small intestine as well as large intestine. እነዚህን ፎርም ያደረጉልን simple columnar epitheliums ናቸው. So the simple columnar epithelium is one layer, and surrounding between the simple columnar epithelium we can get the gastric pit. So this gastric pit is a duct of the gastric gland. የጋስትሪክ ግላንድ ዳክቶቹ ናቸው ጋስትሪክ ፒት ምንላቸው። ስለዚህ በማይክሮስኮፕ እነዚህን ነገሮች ማየት ይኖርብናል። ቱኒካ ሙኮሳ ነው አይደለም ለማለት የመጀመሪያው ሲምፕል ኮለምናር ኤፒቴሊየም ሴሎችን አይደንቲፋይ ማድረግ አለብን። then we should get a gastric pit. ፒቶችን ቀዳዳ የመሳሰሉ ፎልዱ ላይ ፎርም ሆኖ ልታገኙ ትችላላችሁ። እነዚህን ነገሮች ካየን that structure is called tunica mucosa. tunica mucosa ነው ብለን መናገር እንችላለን። So the tunica mucosa is mainly formed from simple columnar epithelium, gastric pit. እነዚህን ሁለት ስትራክቸሮች ደግሞ ሰራውንድ ያደረገልን ወይም ደግሞ እንደ ቤዝመንት ሜምብሬን ሆኖ የሚያገለግልን ስትራክቸር አለ which is called lamina propria. The lamina propria contain connective tissue, blood vessel, nerve and gland. gastric glandoችንም ይዞልን እናገኛለን. So the lamina propria contain blood vessel, artery, nerve, venous drainage, lymphatic drainage, as well as connective tissue and the base of gastric gland. And the lamina propria surround and give strong or it give strength for gastric pit and simple columnar epithelium. So we should get lamina propria when we see in the histology. Histology በምናይበት ጊዜ እነዚህን ነገሮች ደግሞ ማየት ይኖርብናል ማለት ነው. The next layer from tunica mucosa ወደ ውስጥ ስንሄድ we can get the muscularis mucosa. The muscularis mucosa is find more deep to the tunica mucosa. The muscularis mucosa mainly formed from loose connective tissue. Loose connective tissue within this structure can get fat, the lymph nodes, the lymphatic tissue, and blood vessel as well as nerve can be found within muscularis mucosa. So the muscularis mucosa, tunica mucosa is fine. So the tunica mucosa, simple columnar epithelium, lamina propria, muscularis mucosa, gastric pit, they form the tunica mucosa which takes around 2 to 3 centimeters. So find at the end point, the outer parts of the tunica mucosa is muscularis mucosa. Next to muscularis mucosa, we can get submucosa, which is called talar submucosa. The talar submucosa, which contain the loose connective tissue like that of muscularis mucosa, and nerve, blood vessels. እነዚህ ጋር nerve, blood vessel በማይክሮስኮፕ ማየት እንችላለን. Next to the talar submucosa, we can get the muscular part, which is called tunica muscularis. So the tunica muscularis, it contains smooth muscles. በሌሎቹ large intestine, small intestine, esophagus ላይ የምናገኘው የመስኩላር ላየር 2 ላየር ነው የምናገኘው, circular layer and transverse layer. ስቶማክ ከሌሎቹ ለየት የሚያደርገው we can get 3 layers, 3 ሌየሮችን ነው የምናገኘው. The inner one is oblique muscle layer, middle one is circular muscle layer, and the most outer part is longitudinal muscle layer. So ከሌሎቹ ለየት ያለ ስትራክቸር ስቶማክ ላይ የምናገኘው oblique muscle layer. Oblique muscle layer, the layer which is only found within the stomach ላይ ብቻ የምናገኘው layer. The rest, circular muscle layer, longitudinal muscle layer, we can get in the duodenum, jejunum, ileum, large intestine, rectum, anus ምንላችሁ በሙሉ እነዚህ መስል ላየሮች ማግኘት እንችላለን። ነገር ግን ኦብሊክ መስል ላየር የምናገኘው ስቶማክ ላይ ብቻ ነው ማለት ነው. So this is a third layer of the gastric wall. The gastric wall or the third layer of the gastric wall. When we see from the internal parts of the tunica muscularis up to the outer part, the most inner part is called oblique muscle layer. This oblique muscle layer has near to the muscularis layer. submucosa ጋር በጣም የቀረበ ሌየር ነው ቴላ submucosa ጋር ኮንታክት የማድረግ እድሉ ሃይ ነው ማለት ነው and next to the oblique muscle layer we can get the middle layer of the tunica muscularis which is called circular muscle layer and the most outer parts of the tunica muscularis is the longitudinal part. Look, the pyloric sphincter is mainly formed from circular muscle layer. So the pyloric sphincter is the end points of a pyloric canal which is mainly formed from the layer of circular gastric wall. Circular part 2 መጨረሻ ላይ ሄዶ duodenum ጋር ኮንታክት ከሚያደርግበት ቦታ ላይ pyloric sphincterን ፎርም ያደርግልናል ነገር ግን there is one sphincter which is found the lower esophageal sphincter. The lower esophageal sphincter doesn't formed from the muscular layer of the stomach. Stomach ላይ ባሉ muscular layers ፎርም የሚደረግ አይደለም. The lower esophageal sphincter is mainly formed from the lower parts of the lower smooth muscle of esophagus. የኤሶፋገስ lower part 2 ፎርም የሚያደርግልን lower esophageal sphincter ነው ስለዚህ gastric regurgitation ጀርድ ምንላቸው በሽታዎቹ lower esophageal sphincter ጋር የሚፈጠሩ disease related የተለያዩ ኮንዲሽኖች ከኤሶፋገስ ጋር ተመሳሳይ የሆኑ ኮንዲሽኖች አሉ ማለት ነው because the smooth muscle is derived from esophagus so the structure any disease entity is related to esophagus ከesophagus ጋር related ያደርጋሉ but the pylorus sphincter is the disease which is related to the pylorus sphincter is has some relation with gastric because the pyloric sphincter is mainly formed from circular muscle layer. Most outer parts of the tunica muscularis is called the longitudinal. The outer part ላይ የምናገኘው ነው the longitudinal muscle layer. So the longitudinal muscle layer find at the outer part, the inner part is oblique muscle layer, the middle part is circular muscle layer, and the most outer part is longitudinal muscle layer. ስለዚህ እነዚህ ሶስቶቹ muscle layers stomach ላይ እናገኛቸዋለን. Generally those are the tunica mucosa is the most inner part, tela submucosa is the middle part, tunica muscularis is the outer part, but the most outer parts of the gastric wall is called tunica serosa. Tunica serosa is the most outer parts of the gastric wall which is mainly formed from the peritoneum. ከፐሪቶኒየም ፎርም የሚደረጉ ስትራክቸሮች ናቸው the tunica serosa is mainly formed from connective tissue, strong connective tissue and mesothelium of the peritoneum. ከፐሪቶኒየም ጋር ተመሳሳይ ነው because the peritoneum come and cover the stomach wall so we can say that is tunica serosa. Generally the gastric wall has the most inner one tunica mucosa, the middle one is tela submucosa, and the most outer part is tunica muscularis and tunica serosa. እነዚህ gastric wall layers ናቸው Now we discuss about the blood vessel of stomach. የስቶማክን blood vessel እናያለን So the stomach has the blood vessel which derive from the blood vessels that is derived from the stomach is mainly the celiac trunk. So the celiac trunk will give blood supply for stomach. So the left gastric artery give blood supply for the lesser curvature, and this is a common hepatic artery. From the common hepatic artery we can get the gastroduodenal artery. So the gastroduodenal artery it's derived from the common hepatic artery. This is gastroduodenal artery. So the gastroduodenal artery it give blood supply for the right sides of greater curvature by the artery of right gastroduodenal artery እንለዋለን it gives a blood supply for the right sides of greater curvature. And there is also another branch of celiac trunk which is called splenic artery. This is splenic artery of the duodenum, and this artery it gives blood for the fundus of the stomach, and it gives other branch which is called the left gastroduodenal or the left gastropancreatic artery, which is this is a left gastropancreatic artery or gastroepiploic artery የምንለው ነው. It gives blood supply for the left sides of greater curvature. So this is the blood supply of this is celiac trunk, and the celiac trunk it gives common hepatic artery. From common hepatic artery we can get different branches of the stomach, as I told you that ቅድም እንደነገርኳችሁ. So this is a greater curvature. The greater curvature is give innervation from splenic artery as well as the duodenal artery. So the left gastric epiploic artery and the right gastroepiploic artery it give blood for the greater curvature. Greater curvature supply የሚያረጉልን ሁለት አርተሪዎች አሉ. Left gastroepiploic artery. The left gastroepiploic artery it drive from splenic artery. ከስፕሊኒክ artery drive የተደረገ ነው. The right gastroepiploic artery it is branched from the gastroduodenal artery. The gastroduodenal artery is the artery which is branched from the common hepatic artery. The common hepatic artery is branched from the celiac trunk. So the greater curvature has two arteries. The short gastric artery, which is a branch of splenic artery, it gives blood for the fundus and some parts of the cardiac area, some parts of cardiac artery. When we see the artery which supplies the left gastric artery, I mean the lesser curvature, there is two arteries which supplies the lesser curvature. The left gastric artery directly branched from celiac trunk በቀጥታ ነው branched የሚያደርገው, and the other artery which give blood for the lesser curvature is the right gastric artery. This artery is mainly derived from hepatic proper artery. ከhepatic proper artery drive የሚደረግ ነው. Even it does not originate from common hepatic artery. ከcommon hepatic artery ላይ ሳይሆን ወደ liver የሚሄድ artery አለ which is called hepatic proper artery. ከዛ የሚነሳ generally the lesser curvature get blood supply from left gastric artery and right gastric artery. እነዚህ ሁለት አርተሪዎች blood ያገኛል ማለት ነው.